Hello and welcome to this reality check special. Many hands are behind India's hitting the 1 billion vaccine doses mark. But perhaps one of the most significant hands has been that of the Serum Institute of India, which has supplied close to 90% of that 1 billion figure, estimated almost 90 crore doses of that 100 crore doses has been Covishield. And Adar Poonawalla, CEO and owner of Serum Institute of India, joins me on the program. Adar Poonawalla, congratulations to you. I mean, as you know, everybody, but also to you. 90% of a billion doses, Adar Poonawalla, that's remarkable, but also the pressure.
You know, we're just so relieved. I am at least, and everyone here at Serum Institute is, that we've been at least been able to play our part as promised. And, you know, the credit, as you rightly mentioned, goes to the healthcare workers, the government officials for executing, you know, finally, and putting the jabs in arms and vaccinating everybody, because that's perhaps even harder than making the vaccine, you know, getting people to come in and take the jab and then following that up and having a digitized platform for it. But yeah, I mean, you know, we're just relieved that we were able to and have delivered, you know, before the end of the year, as promised in 2021, a billion doses, which we're very comfortably now on track to do. And, you know, we scaled up also in between multiple times to go way beyond the 100 million dose per month production. Now we're at 220 plus million doses per month that we're delivering from October onwards.
Wow. You know, when one looks at the numbers now, one almost tends to forget how jittery things were earlier in the year. You know, there were reports of shortages. Briefly, exports had to be stopped. Again, no fault of yours. This also has to do with, you know, how all of this was planned or not planned. But were there moments of anxiety and stress at that time?
Every week there was something new, whether it was a permission or license, whether it was some issue with raw materials, whether it was some media article. You know, never have I ever had to go through such public scrutiny being a privately listed company, because, you know, the world and India was looking upon a few select vaccine producers and others to deliver. And of course, there was stress and anxiety because, you know, we were in very uncertain times and with very little information at that time, knowing about the disease, whether the vaccines will work, how much anyone will be able to produce. And of course, don't forget, Prime Minister Modi's challenge was such a large population. No other world leader had to deal with such a large population in you know, a diverse geography and with different, you know, cultures and other barriers and issues to deal with. So, you know, navigating through all of that and making such a large volume of product and then having it delivered, you know, we have to give his leadership credit also that, you know, at a point, yes, it was looking bad, but, you know, it was nobody's fault. We just all did the best we could, and look at where we are now compared to so many other countries.
No, that's true. On a somewhat lighter note, you at one point said in an interview in May that you were getting threatening calls from very powerful people. I assume that stopped now.
No, that was a little exaggerated in the sense that, you know, those chaps over there had twisted it as well. It wasn't to the point where I had to leave the country or anything. It was just coincidental that I happened to be in the UK at that time. What it was is that there was a lot of pressure that everybody wanted it first. And when there's limited stock to go around, whether it is the states, whether it is private groups, whether it is anybody, you know, everyone wanted it and they couldn't understand or didn't want to wait and understand why they had to wait in line.
Fair enough.
But as soon everyone understood that that's something nobody can do anything about, and everyone then fell into place and sort of, you know, waited their turn. And in, I think, June or July, again, we were in a very comfortable
things started to turn around. So while obviously hitting a 1 billion landmark is quite phenomenal, Adar, there are concerns particularly about the large gap between the number of people who've been vaccinated by the first and the second dose. So at the moment, only 21% of our entire population is vaccinated with both doses, which is quite low compared to a country like China, sizable population, comparable population, which has done about 75% of all citizens have had both doses. Is that an area of concern?
Well, I mean, if you look at, let me answer that in two parts. Firstly, we've shown that you get a sort of 60 to 65% protection with even one dose. So giving one dose to a large part of the population when you have second and third waves on the anvil is the right strategy, because you do give and get a lot of protection. So if you look at hospitalizations that get prevented through the first dose and the second dose, you've almost got a 80 to 90% prevention against serious disease with one dose, 60% protection generally overall, efficacy. And if you look at two doses, you go to a 99% level of bringing down these severe hospitalized cases with two doses.
Right.
Now, so from that angle, we're sort of okay. And given, to answer it in the second part, the huge volumes coming about, both from us and from Bharat Biotech and other vaccine producers in October, November, December, you're going to see a huge catch up in the next 2 months to cover up. And by December, and I don't want to make any predictions, but you know, if that's one thing this pandemic has taught us, nobody should make any forward-looking predictions or guesstimates. True. But I think we're very safely going to be able to protect by the end of December, you know, and cover up, to answer your point, everyone with who's had one dose to get two doses.
Right, yeah, because the government's own estimates suggest that it may take a little bit of time to hit that target of vaccinating the entire adult population by December. And that's where I brought this up also, because in terms of the numbers, because as I said, again, it's phenomenal that you've been able to ramp up to the number that you have, that we've hit this number. But if you look at really where we stand, that we need to be doing about 1.5 crore doses a day, 15 million doses a day to be able to hit those government's targets. So we need to be ideally doing a production of about 450 million a month. Right now we're doing about half of that. You said you're at about 220 million a month, if I'm not mistaken. You know, Covaxin is at about 60 million doses a month. Now, is it realistic to expect a major ramp up of that scale?
Yeah, let me clarify that point. Look at the daily vaccinations that are happening today, despite having enough vaccine stocks. You see, it's a combination of partly human hesitancy or lethargy. You know, the panic, if you remember, the way people were queuing up, knowing even though that there aren't enough vaccine shots at a vaccination center, that panic has reduced. That urgency is reduced. And as a result, you're seeing, through no one's fault, to be honest, the daily vaccination sort of slowing down. Now, this is not because of shortage of vaccine stock. I think you can check from the government records. They must be having 70, 80 million doses between different states and other places available. And, you know, everyone is, including the government, is encouraging people to come forward. But, you know, unless people physically come forward, you're not going to reach that number that you're talking about. And as of now, you're seeing at least a 3-week to a month buffer stock between production figures and delivery.
I see.
And what is in the storages. So
I see. Okay, so you're saying that actually we are at the moment producing more than we're consuming, and actually the numbers suggest that your argument is not far off the mark, Adar, because at the moment, the last week for which we checked the average, we're doing about 53 lakh doses a day, while we're producing about double of that. So some of that, as you said, could be because, again, because there's now not that sense of impending panic, it's starting to taper off a bit. You know,
yes, so you know, this is the time where we really need to again remind everyone that get both doses, get fully protected, because God forbid if there is a third wave, and we don't believe it's going to be as severe as the second wave was, because, we're better prepared with
Sure.
all our health systems and infrastructure and so many other things, including, of course, having vaccinated a major portion of the country with one dose. It is still important to remind people that, what happened a couple of months ago, and please get your second dose. Some people are just so lethargic that they don't want to even take a second dose at the moment. This is, the grassroots feedback I've been getting. So we really need to remind people of that and get them to come to the vaccination centers.
Right. And but give us a sense, Adar, that in the event that people do start to step up and there is a greater kind of, again, a using of the vaccines or a consumption of vaccines, where are you looking at your own production in terms of, like right now you said it's about 220 million doses a month, that's about 22 crore doses a month. What's the scale up that you have planned out?
Well, I mean, we've got 4 to 5 different factories and buildings
Okay.
making Covishield. We've got another 2-3 plants that are going to make Sputnik Light and Covovax in the next couple of months.
Right.
So, we're going to always have that extra buffer of vaccines available for India. We're planning to export those 2 vaccines predominantly, given the fact that Covishield is taking care of India and the fact that, if you look at all the travel regulations and issues we've faced in the last 6 months,
Yes.
Covishield is now finally approved with the UK, European countries, Australia, so many other parts
Yes.
of the world. I don't want to have to go through all of that again for our Indian citizens with the new vaccines.
No,
Today's
that's fair enough. But
in an emergency, we still, to answer your question, between the other 2 vaccines, we'll have another 100 to 150 million doses per month between Sputnik Light and Covovax.
Okay.
If you have that, you
Yes.
know that India is secure in case we again need to rush more vaccine stock. But as I said, at the moment, you don't want vaccine stock to expire. You want to start exporting vaccines now, because the world is depending on you. India's reputation is really at stake today with all the promises we made.
Sure.
And India is the pharmacy of the world, and we need to get back to doing that. So the strategy now on this takes care of the whole perspective.
Okay, I want to come to exports in just a second because that's an important point you made, but I'm just trying to understand from you. So right now you're at 220. If you add another 150 million, as you said, with these 2 other vaccines, Covovax and Sputnik, that brings you to about 370 million a month. Is that a fair ballpark?
Look, that's what we're hoping to reach by January. Scaling up slowly from now till then. But don't forget, there are other Indian vaccine manufacturers also who will be playing a role, and I'm sure they will be able to together make at least 100 million a month.
Well, they ought to be, but and this is not to run down anybody else, but at the moment, let's face it.
They're scaling up, Srinivasan. Look, I have no doubt in my mind that the other Indian vaccine manufacturers will play a substantial role in building the capacity, and you're going to see that coming on very soon.
Okay.
So when you combine all of that, you're going to have way more than the 300 million a month in totality that you need, even assuming that India goes back to a 10 million dose per day vaccination rate.
Okay. Okay, but let's now talk about exports, because there was a point where you had to stop exports because of the domestic crunch, and I can imagine that wouldn't have been great for you because you are, one of the leading vaccine manufacturers in the world, but there were commitments you couldn't honor. How much at that time was that a problem for you?
That was a huge problem. In fact, a part of the reasons I went to the UK was to settle all those lawsuits and also returning part of that funding and reinstating our commitment to support them, later on in the year. At that time they couldn't travel to India. So I had to have some face-to-face meetings to explain to some donors and partners that, including AstraZeneca, why I have to give vaccines to my country and then resume exports coming back in October, November.
Right.
Which took a little time to explain. It cost us a substantial amount, more than $100 million had to be refunded back to them. COVAX has stood by us even today. We've not refunded any of the money that we used to build the plants and offer them this low price and for the low and middle income countries, namely the African continent.
Right.
And they're really counting on us now, so for the end of October, November, to start re-exporting a few doses.
Right. So that's exactly what I now wanted to ask you, because the government has now said that you can start exports. So have you already started exporting? And if so, what is it? Are you exporting Covishield or some of the others?
Yes. So Covishield naturally being the only WHO approved vaccine that we have. Eventually when Covovax gets WHO approved as well in the next 2.5 months, I would guesstimate, we will export that as well.
But Covishield exports have started already?
No, I think they will go very soon in this week or the next week. But again, the volumes are going to be very small. We'll wait for the directions from the government of India. I'm sure they'll make that public very soon.
Okay.
But look, between October and December, the exports are going to be very small.
Okay.
Maybe 20 million, maybe 30 million a month, something like that.
Okay.
It is in January 22 is when I expect to be, able to export very large volumes, because the obvious points that we've already covered will have been addressed.
Right.
India will have vaccinated with 2 doses. You will have had other Indian vaccine producers also demonstrating and giving more capacity, including, our own. So, we'll be in a far better situation even by Christmas Day, if you look at that as another milestone.
Right.
Where, you can then start exporting even large quantities.
Right.
That.
Just one concern on that, Adar, because there's also been talk, as you know, of the need for a third shot or a booster shot, right? And there's been that Oxford study earlier this year which found that efficacy falls anywhere from about 80% to 70% after 6 months for your vaccine, for Oxford AstraZeneca. Similar numbers for the other vaccines, Pfizer as well. In that event, will there again be a possible need to boost the numbers for India? And then again, that whole question of, if we do need the booster shot, then how do we manage exports?
I've factored that in.
Okay.
But if you now look at the capacity that we're operating at just for Covishield, at 220 plus million doses a month.
Right.
Even if I assume that India would require booster shots to the tune of roughly maybe 100 million a month, starting January onwards.
Right.
And that's on the higher figure. I would guesstimate it would be around 50, because again, it would be more targeted to the vulnerable first and then going down
Right.
to the less vulnerable population. We've got more than enough capacity to then fulfill the export commitments and keep enough shots for the booster. But again, we'll wait for the science to tell us when to activate that. And the Government of India team of experts who will tell us when the right time is to start a booster. I think right now the priority is give everyone 2 doses.
Right.
And maybe some of the vulnerable people later on next year get a booster, if they need it.
But you think it's important to have that booster based on whatever you've seen or read of the science
Yes,
so far?
I mean, from what I've read, and I've looked at all other vaccines, including the Pfizer Moderna vaccine, which has already started giving boosters in the US. I think a safe bet is you wait for a year after your first dose, and that would be probably the right timeline to look at a booster dose. But again, ethically, the question is that do we not start giving the rest of humanity 2 doses first before anyone else gets a booster? Because,
Right.
just look at it from not just my position, but the world's position,
Sure.
WHO and COVAX and everyone, that is it fair that only 3% of Africa is vaccinated? Whilst we start now taking, 3 doses and boosters and all of that, what about those guys who haven't even had 2 doses? So,
That's an
we have to
interesting
look at
point.
the humanitarian angle as a species, as a global scenario.
Right.
Because you want those economies and countries to also open up. And sadly, there aren't many companies in the world wanting to provide a vaccine at $3 a dose to the African continent. And that is where we play a major role, and that is why COVAX is depending on us. And I really want to support, that initiative before I look at giving more boosters. Of course, we'll always have enough stock for our nation to give boosters to the vulnerable and the elderly. I mean, that is a very small portion compared to the rest of the healthy population in India.
Sure.
Which
No,
probably
that's
will
a very...
not need a booster till, I would say, at least Q2 or Q3 of next year. But
Right.
if the government decides that we need booster shots earlier, we have the capacity and we're ready to, of course, cooperate with that.
Wow, okay, because you're saying that you can actually, that's a valuable ethical point you made, by the way, because, you are, as in Serum Institute, is such an important component of an initiative like COVAX to supply affordable vaccines, particularly to the developing world. But you're saying you can do your 220 million, even if you need an additional booster shot of 100 odd million, that's 320 million for India. You can do that and have enough to export and meet your export commitments? Because that's
I mean,
that's quite an ask from your production, from your production line.
Let me clarify. It will be 220 to 240 million.
Right.
Out of that, even if you keep 100 million aside for booster shots for the country, you're still very comfortable.
Right.
Because even if you assume, giving 100 million doses of booster shots to the country, you've got other vaccine manufacturers to add maybe 20, 30, 40 million in that.
Right.
So even if you look at a booster regime of 100 to 150 million a month
Right.
to be taken, firstly, we don't know how many people will come forward for a booster shot.
Yeah.
Everyone knows they wanted to take 2 doses, they took them.
Yeah.
You're already seeing resistance, number one.
True.
Number two, by next year, the panic and the cases, if they go down further, I don't know how many people will come forward for a booster shot.
No,
So
that's
it's a
true.
very small percentage of the population which will want it and deserve it because, as I said, ethically, you really have to be in a very vulnerable population segment to get it, both ethically and scientifically. I mean, there would be really no need to vaccinate healthy individuals with booster shots
That's true.
At least until a year or two passes.
Right.
And then definitely we need a booster shot. 100%.
No,
but
fair
let us
enough.
vaccinate the rest of the world first and then come back to the booster.
No, that's true. I think you're right to say that there's still questions over how many will need it. As we wrap, I just wanted to ask you, when you look back at this journey, this 1 billion journey, I want you to recall for us one exhilarating moment for you and one truly just scary moment. Like, what was the scariest moment and what was like the most
Well, I
biggest high?
mean, to pin it down to 1 or 2 moments is tough.
Okay, but
I think you all have all followed the journey with the huge public scrutiny that we've all gone through.
Yeah.
I think, of course, the continuous pressure to perform and deliver was one, but I think the exhilarating moment was finally on the 3rd or 4th of January, when we were finally licensed.
Right.
By the Drug Controller of India and Ministry of Health to launch the vaccine. It all made everything worthwhile. The risks we took, the investments and blood and sweat that the team and everyone went through working till 10, 11 at night, was a major sort of relief.
Right.
And of course, the I wouldn't call it a blow, but the kind of a downer was when we could not export, when we had to suddenly rush and double, triple our capacities when the second wave came. That was particularly a very, very stressful moment because we really didn't know which way things are going to turn.
Right.
And that was particularly a very, very low and bad period, for the nation, for everybody, not just for us.
No, of course.
I would pin it down to that. But, apart from that, every day has been a challenge, but we've overcome it. We've figured our way through and now we're in a good place.
And here we are. And here we are today. But it's been quite a journey, Aadhar Poonawalla, and it's great as always to have you on with us. All the very best for everything that you have planned, and thank you so much for joining us.
Pleasure. Thank you.